Hello, I am Dr. Bishas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I'm Joy, 25 years of age.
Okay, Mr. Joy. I have got a letter from your GP saying that you have back pain. Is it right?
Yes, doctor, actually, I'm suffering from this pain and I'm a bit concerned.
Okay, I am going to talk about your issue, and during our conversation, I may take some note, and all the information during our conversation will be remain confidential. So is that okay for you?
Yes, of course, doctor.
Okay, so can you please tell me in more details what is happening with you?
Well, actually, doctor, I think I was quite well around 2 months back, but since then, I think that I have been developing some pain in my back, and at first I didn't care about it very much. I just I think that pain was actually more while doing some hard work. Okay, but now I think that it's getting more and more serious as the day is progressing. So I'm a bit worried, doctor.
Yeah, I'm sorry to hear that. And can you tell me the exact site, or can you show me the exact site where do you feel the pain?
Well, actually, that's just in the back, in the midline of the back. Okay.
Okay, that is middle of the back, not in the lower part or not in the upper part.
No, it's quite in the lower part, I think, but in the midline, I think.
Okay, in the middle.
Not upper part.
Okay, in the middle part and in the lower back.
Okay. I think it's lower. Yeah.
And can you remember, did it start suddenly or gradually?
Well, I think it's quite gradually, doctor, because at the beginning I couldn't feel it that much way. I told you that I just felt that when I have to work for long distance, actually I'm helper at a container depot, so I have to go for long distances. Okay, so at first when I had to go for long distances, I just started to feel some pain. But nowadays, just when I just walk also for some quite some time, or to take some exercise, I am feeling the pain. So I think it's quite gradual, doctor, and now it's increasing.
I'm sorry to hear that, and it was for last 2 months. And
yes, doctor.
okay. And can you remember that?
I think it's about 2 months. It might be a bit earlier also, but I haven't quite. I can't be very specific about it because it was a gradual, you know. Okay.
Not a problem. So can you tell me that did you notice any injury or any abnormal event before the start of this pain?
No.
Okay. And for the last 2 months, how frequently do you have this pain?
Well, doctor, actually, one of the good sign is this: I don't feel pain while I am at rest. But since you know that I have been working some hectic job, doing some hectic job, so it's been increasing now, actually, doctor. So I'm a bit bothered.
Okay, I can understand. And can you tell me that do you feel this pain every day whenever you do your job?
Yeah, actually, now I'm feeling every day, doctor. Quite for quite a long time. I think that it's for the last 15 to 20 days. I think that it's almost most of the time that I do work, I feel some pain, some dull pain.
Okay. And can you tell me that how do you feel the pain? Can you express your feeling about the pain?
I think it's dull aching pain, doctor.
Okay.
It's aching pain, dull aching pain, and it is a bit irritating.
Okay. And does this pain go anywhere?
No, I haven't felt so.
And remain at the same point?
I think more or less it remains at the same point.
Okay. And along with the pain, have you noticed a raised temperature?
No, doctor, no.
Any swelling?
No, doctor.
Okay. Any redness?
No.
Any problem with your bowel?
Yes, doctor. That's one thing I would like to tell. But I think for around the last 6 months, I think I've been facing some problems with the bowel. I think that at times I have some loose motion, doctor.
And when did you have this loose motion?
Actually, doctor, I think that I have this loose motion after having food.
Okay. And how many times did you have that?
I think that nowadays I have to open up my bowel for 4 to 5 times a day.
Okay. Have you noticed any blood in your stool?
No, doctor.
And do you have to go to the toilet at night?
1 or 2 times, I think, doctor. I had to go.
At night?
Yes, 1 or 2 times.
Any pain in your tummy?
Uh, I cannot specify, but I think some discomfort. I feel some discomfort in my tummy at times when I have to go for washroom frequently.
I'm sorry to hear that. And you have you noticed any black terry stool anytime?
No blood. Never. I've never faced any blood.
Okay. And you don't have any tummy pain. And how about your appetite?
I think it's quite well, doctor.
Okay. Any nausea?
No, I don't feel any.
Coming to your pain. And do you have any problem with your water work?
No, doctor. I haven't felt like that.
Okay. Any weakness at your legs?
No, doctor. No, I cannot specify.
Any changes in the sensation in your legs?
No.
Okay. And can you tell me the timing of your pain? Does this pain remains at night or in the morning?
Doctor, I cannot specify it, but I think that I feel more pain after having my food, and then I have to open up my bowels nowadays.
Okay. And your back pain?
Yeah.
After taking food, you feel more back pain.
No, not back pain, doctor. I feel I have to go open up my bowel, doctor. I'm telling about that.
Okay. And
And back pain also, I haven't just, I haven't. Now you're telling me that I think there might be back pain also increases, might be after taking food.
okay. And do you have this pain at night? Your back pain?
I haven't noticed in that way, doctor.
Okay.
But I had to open up my bowels once or twice.
Do you have any morning stiffness?
No,
Do you have any headache?
no, doctor.
Any rash anywhere in your body?
Yeah, doctor. Yeah, you have asked it with. I'm happy that you have asked it. I think that I've been having some small these rashes. I think in my elbows. Okay, and also in my buttock region for the last 4 or 5 months.
Is it painful?
Not that much, but it's very itchy, and I had to itch it for quite a long time of the day.
Okay. And when this rash came for 5 to 6 months ago?
Yeah. I think for the time being.
Okay, I can understand. And can you tell me that do you have any noticed any changes in your vision?
Not quite, doctor, but I think that recently I have noticed that I sometimes feel some problems while going out in the dark. Okay.
I can understand. And can did anybody say that you are becoming more pale?
Nobody told me. I haven't felt in that way.
Okay. And you said that your appetite is good. How about your weight?
I think it has lost a bit. I've lost a bit weight, but I haven't been. I have been observing in a well mannered and a well organized manner. I can't tell it specifically.
Okay, that's not a problem. And do you have any hot or cold preferences?
No,
Okay. Any chest pain?
no,
Any cough?
no,
Any shortness of breath?
no, doctor.
Okay, that's fine. And can you tell me that do you have any known past medical condition that you would like to share?
No, I don't think that I have. I'm such a young man, doctor. What past medical condition will I have?
Okay.
But till you ask me about the rash, I'm going to I forgot to tell you that very recently, for the last 1 month, I have been feeling that I have some sores in my mouth as well. Okay, and that is also a bit bothering.
Okay, I can understand. And any sore at your private parts?
No,
And do you take any medication?
no, doctor. This is the first time I came here, and please help me because I don't. I'm afraid of the doctors.
Do you take any over-the-counter medication or any herbal products?
No,
Do you have any
sometimes I
allergic?
smoke. No, doctor. No,
Okay. And any of your family member have this type of condition?
no.
Any
I
of
don't know.
Okay, that's not a problem. Any cancer in your family? Cancer in the bowel?
Yes, I think one uncle of mine had some cancer, but I don't think it's in the bowel. I think he had lung cancer.
And may I ask you a few more personal questions?
Of course,
Do you smoke cigarette?
sometimes, doctor, 3 to 4 sticks. Sometimes when I feel a bit low, and recently I have to smoke up more because of this back pain and also the troubles in my tummy, troubles in my bowel movements.
Okay. And smoking is injurious to health, so I would recommend you stop smoking. And if you need help, we can refer you to the smoking cessation clinic. Okay. So can you tell me that
Okay,
do
okay.
you drink alcohol?
Within social limit, doctor. Sometimes 1 to 2 pints, but never more than that. No binge drinking.
Okay, that's good. And may I know that what do you do for living?
Yes, I told that I've worked in a work container depot and I have to go long distances.
And, do you need to lift heavy weight?
At times, doctor, at times.
Okay. And I am sorry to ask that do you take any intravenous drugs or IV drugs?
No, never, doctor, never.
Okay. And whom do you live with?
I leave alone, doctor.
Okay. And may I know that what is your concern?
Doctor, what's happening, doctor? I'm getting ill day by day. I just don't like it. What's happening?
Okay. At this condition, I need to examine you, then I could give you the best explanation. And as I have taken your history, I think regarding your back pain, it is more likely to be that is we call mechanical. That is most likely related to your working habit. So we will advise you, and we will talk to the occupational health department, and they can give you better advice on this. Okay.
Okay.
And also I also introduce that as you have some bowel problem, and you have rash on the elbow and the back, and also mouth ulcer. Upon this, I also think that you have another condition that also may be related or precipitate your back pain. That is we call celiac disease.
What is this, doctor? I'm afraid to hear. What is this disease?
Okay, actually it is a disease where the lining of our gut become uh, uh, ulcerated, or lining of our gut become somewhat deranged by our own body cell. So that bowel cannot work properly, so that there might be some deficiency in the vitamin. That also you said that you are seeing less in the dark area. So, and also back pain that may be also due to some vitamin deficiency. that also precipitate this condition. So we also need to evaluate that, and for this we may need to do some camera test of your gut. And before that, we will need to do some blood test, some imaging test of your back, and we may also need to test your skin.
Okay. Okay, doctor. So it's curable, doctor. What do you think?
Actually, with some dietary habits, I have forgotten to ask you that do you have any special diet?
Not special, doctor. I'm a Bengali people, so I eat rice. So what's special in it?
Okay, but there are some types of food that can aggravate this bowel problem. So we will also take a review from the bowel doctor, and they can give you, and also you take review from the dietitian. They can give you the advice that what type of diet you should take, so that can also help you a little and help you a lot more. And also we will give you some medication that will suppress
I
your.
think time is
Okay, thank you.
okay. Welcome. Well, what do you think? What will be the disease in this case?
Okay, for his back pain, I think it is a mechanical back pain. Also, this back pain may be due to osteomalacia from deficiency of calcium due to deficiency of vitamin D, that can be result from celiac disease. And
Okay.
so for this patient, I will considering that the patient have also dermatitis herpetiformis.
Yeah. So what do you think that what should be done for skin problems?
Okay, for skin problems, first we need to give him education and advice. Then for underlying condition, that is celiac disease, we should also treat that. And for solely skin condition, it can be treated with topical steroid. Then if that doesn't work, then we can go for oral medications like Dapsone.
Okay. And I would like to know that before giving Dapsone, do you think that you need to do any test?
Yes, I need to do the complete blood count to see if he has anemia, and also if I need to do the peripheral blood film if he have any abnormal red cell. That is glucose.
Yeah.
That is glucose
Yeah.
phosphate.
Excellent, doctor. Excellent. Yeah, that's an excellent one. And can you please tell me that what investigation is now considered more specific for this?
Gamma
For today,
glutamyl. I think for his celiac disease, gamma glutamyl transferase. That's for blood test, gamma glutamyl transferase.
Well, I think that it's not gamma glutamine.
Sorry.
It's tissue transglutaminase. Okay, NTTG.
Yes, it is tissue transglutamine.
Yeah. That's more specific, I think. Okay, and that's very good, doctor. And okay, and I think that's all for today. And you have done it fairly well. But I think you should have asked about his food habit in detail while you were taking the history, because I repeatedly told that
I missed.
I had this problem after taking food, and just which kind of food. I think if you gave some time, I think that would have been much better at that moment. Okay. And that's one thing. And I also told about that soreness of my mouth by myself. Okay, so I think you could have asked that too. Any soreness in the mouth, because celiac disease, I think it's much more associated with some oral soreness and dermatitis herpetiformis, if I'm not wrong. Okay. Yeah. So that's all. And
I should have taken the sexual history. I forgot that.
Yeah. Travel history, sexual history, that's could have been important.
This is very important, but I forgot.
Yeah. So because however, I think HIV should have been excluded, although he doesn't complain about any fever, but yet since he has some rash, and I told about oral sore, I think that HIV should have been excluded. Okay. Yeah. So that's all for today, and I think that's an excellent presentation from you, doctor. So thank you.
Thank you.